Hi, this is Matt from Rogue Reset. This video will discuss the different types of saunas and their benefits. Traditional saunas heat the air around you, which in turn increases your internal body temperature or increases your core temperature. The sauna I'm currently in is 60 degrees Celsius, about 140 degrees Fahrenheit. Ideally, you'd want the temperature a little bit higher. I think the sweet spot is about 175 degrees. This is still giving me a pretty good sweat. We can also add water to the rocks directly, which will increase the humidity in the room. The ideal humidity for a sauna is about 10 to 20% humidity. Right now, I'm in my brother's infrared sauna. Infrared saunas use near, mid, and far infrared radiation to heat your core directly. Typically, these saunas don't get as hot as a traditional Finnish sauna. Average temperature for a infrared sauna can range around 140 degrees Fahrenheit. By using a sauna, we introduce our bodies to something called hormetic stress. Hormetic stress is the ideal exposure to a stressor where it becomes beneficial to your body by building resiliency to that stress. You can use this for sauna, or you can also use it in terms of cold plunging. By introducing ourselves to hormetic stress, a physiological cascade of benefits follows this stress. Another benefit of using a sauna is it releases dynorphin. Dynorphin, as opposed to endorphin, is that terrible feeling you get when you're a little bit too hot. Similarly, people withdrawing from alcohol also have this dynorphin release. Endorphin makes us feel good. These chemicals bond to mu opioid receptors. Dynorphin binds to kappa opioid receptors, and this is what we're trying to trigger. When dynorphin bonds to these receptors, it promotes a stronger bond between endorphin and its receptors. This makes the effect of endorphin stronger, leading to more pleasurable experiences outside of this hormetic stress. This starts a cascade of reaction that activates something called heat shock proteins. These heat shock proteins repair damaged and misfolded proteins. Sauna use also mimics moderate cardiovascular exercise. This improves cardiovascular function by lowering blood pressure, lowering your resting heart rate, increases your plasma volume, and you have improved cardiovascular compliance overall. Another benefit of sauna is that it increases blood flow to skin and muscles. This will give you faster recovery from workouts. Improve skin health, mainly with a more balanced surface pH and hydration. Sweating depletes zinc. It's important to replete your zinc after sauna use. You can either do this through the use of supplementation or through your diet. Improved fasting glucose and insulin sensitivity. Now here's a really interesting benefit of saunas. It can actually increase your brain activity through the release of BDNF, which is brain-derived neurotrophic factor, and this is needed for cognitive health. BDNF regulates synaptic plasticity, which allows our neurons to communicate more effectively. It also aids in learning and memory. One study showed a 310% increase in norepinephrine following sauna use. This enhances focus and attention. There's also a 10-fold increase in prolactin, which promotes myelin growth. Basically, this aids in learning and memory by protecting the myelin sheaths covering the neuron. BDNF has also been shown to be effective with muscle repair and formation of new muscle tissue. Heat shock proteins are essential for cellular repair and maintenance. These heat shock proteins help other proteins to maintain their three-dimensional structure and function. Aids in the removal of cellular debris. They also have other roles in immune function, cell signaling, and cell cycle regulation. Using a sauna can also improve your mood by causing an increase in beta endorphins. One study actually showed that by increasing your core temperature to 101.3 degrees Fahrenheit for 30 minutes had lasting effects, antidepressant effects for up to 6 weeks.
Wow.
Saunas can also help with pain by releasing epinephrine norepinephrine, cortisol, and IGF-1, we can have a more robust anti-inflammatory effect, better immunity, and lower risk of infection. Excretion of heavy metals via your sweat, mainly aluminum, arsenic, lead, cadmium, mercury, and BPA, which are found in plastics. It can also lower your risk of high cholesterol and your risk for high blood pressure. Finland observational studies show frequent sauna use decreases cardiovascular risk, sudden cardiac death, coronary artery disease, stroke, and dementia. Saunas can also help you relax by decreasing your cortisol levels. Studies have shown that lower levels of BDNF can play a role in depression and anxiety. So by boosting your BDNF, you can reduce your stress. Increases blood flow to the brain. Now, most of the studies that have been done focus on traditional Finnish saunas rather than infrared saunas, but the benefits can be very similar. And the benefits are dose dependent. So temperature, time exposed, and frequency play a role in the overall benefits you're going to get from a sauna. The ideal sweet spot while using a traditional sauna is about 174 degrees. And you want your exposure time to be at least 20 minutes with an ideal humidity of 10 to 20%. By using a sauna 2 to 3 times a week, you can decrease your risk of sudden cardiac death by 22% and lower your dementia risk by 20%. Now, if we increase this to 4 to 7 times per week, we see a 63% decrease in your risk to die from sudden cardiac death. There's a 60 to 66% decrease in your risk for dementia and a 40% reduction in all-cause mortality. This is something, basically anything that can kill you based on chronic disease or another comorbidity. 40% decrease in your risk of stroke and a 40% reduction in your risk for high blood pressure. When using a sauna, it's also important to address safety. One of the main things is you want to stay hydrated. So by drinking water through your sauna session and before and after, you'll maintain hydration. But you also have to pay attention to your electrolytes. You'll lose sodium, magnesium, potassium, and zinc. If you're currently pregnant, it's wise to avoid sauna use. There have been some data that show that it can cause fetal abnormalities. When you're in the sauna, don't drink alcohol. Elderly folks should also be cautious using a sauna, not only for the risk of dehydration, this can also lower your blood pressure and put you at risk to lose consciousness if your blood pressure drops too low. And you don't want to do that when you're alone in a sauna. Avoid a sauna if you've had a recent myocardial infarction or heart attack, or you have unstable angina or aortic stenosis. Children should also avoid using the sauna. There are countries that introduce children to saunas fairly early, but they've been doing that for a long time, and I think they know what they're doing. Also be aware that continuous glucose monitors can show a transient increase in blood sugar as you sweat, but these levels should return to normal as you stop sweating and when you get out of the sauna.
Thanks for watching, and be sure to follow Rogue Reset on YouTube and our other social media pages on Facebook, Instagram, and TikTok.